To my channel. It's your favorite incoming physician, future Dr. Johnson. Welcome, welcome, welcome. If this is your first time viewing my channel, my YouTube channel, I would like to say welcome. If you are a recurring subscriber or even recurring viewer, I would like to say welcome. Don't forget to hit that like, share, and comment button. Whichever platform that you'll be watching this video, TikTok, Facebook, Instagram, I'll also like to say welcome and thank you for viewing my video. So as I stated, the purpose of every content that I create, I'm here to talk about faith, medicine, and beauty. So today we will be talking about the medical aspect of things. And my topic here for today will be, as you can see on my screen right here, mental health, right? Mental health. And one thing I would say, I've been a CNA for over 12 plus years, roughly close to 13-ish plus year. I've worked in variety healthcare spectrum, such as assisted living, memory care, geriatric, and I've also worked in the operation room, and I've done like private duty where they'll call it like home health aid kind of stuff. And now I currently working as a mental health technician at my local mental health hospital. So my purpose here today is to just educate you guys, to educate you, my viewers, about the importance of mental health and what is mental health, so you can have a little bit of inside depth of mental health and some of the signs and the symptom. Please keep in mind, I am not a licensed psychiatrist, neither a licensed registered nurse. So for any further information, please consult with your psychiatrist if you are experiencing any mental health issues and etc. So let us get into this video. Let's get into this video. When you look at mental health from the emotional portion of that individual or the person that is battling with things from their health perspective, like it's very hard for them to understand, or it's hard. They struggle with how they experience things and manage their feelings, such as anger issues, or when they're sad, or when they're happy. It's very hard for them to balance all of those emotions, and it's hard for them to manage emotional like reaction towards things, such as staying calm during a conflict, such as processing grief after loss, feeling joy or connected to someone. So this is where that's a sign. If you have a loved one or have encountered someone who's battling with these symptoms, there are so many type of disorder and symptoms that people battle with in the mental health spectrum as a whole. And then when you get down to the psychological aspect of mental health, right? These things can be a bit crucial. Here you see the person thinking patterns, self-esteem, problem-solving skills, decision-making, and attention and memory spans play a huge role in this whole portion, right? So, like for example, believing in yourself to overcome challenges. As a person, it's easy for you and I to to operate with those things. It's easy for us to avoid destructive thoughts or situation, but for a person who is who has mental health issue, it's very hard for them to do those things. So you'll see a little bit of struggles in the line of their daily routine, where sometimes it's very hard for them to express things, like next minute you'll encounter them where they're happy from working in mental health. Now I'm giving you my experience where I've met, encounter so many patients where sometimes their emotion is just all over the place, and sometimes it doesn't mean any harm. They're only trying to process or figure out a way to express themselves, and sometimes it could be good, and sometimes God knows it can be the beautiful rainbow in the sky in that moment. So a lot of fireworks, for those who have experience and is currently working in mental health, they know what I mean when I say fireworks. And God bless us, bless every nurses and care team who works in mental health, because it's not easy. It's a very demanding field profession, and also stressful, but we've learned to check on one another and extend grace and love unto each other, no matter what we do as a team. On the for a person who is battling with mental health, their social health is very poor. This is about like their relationship and interaction with others. So the key aspect will be like communication skills, boundaries, support systems, and sense of belonging, right? So example would be, how do they maintain friendship or relationship with their loved ones? Do they ask questions if they need help? How are they feeling when they're connected to a family member or within the community? So all of these things are things that healthcare providers look at and try to analyze and see, like, okay, how are they coping with this? How their, their relationship skills, their social skills. And some people have social anxiety, and this is where it falls under mental health. Then you look at the behavior aspect of that person's life, right? So this shows the behavior, the individual behaviors and their habits, right? Such as their sleep pattern, such as eating habits, such as exercising, substance uses, work or school, you know, frequency of functioning, or how they're processing things in their daily life. And if these things are all challenging for them in early stages, roughly like in adolescent age and stuff, and throughout their adulthood, most definitely that person is battling with some form of mental illnesses. Then we jog down to common mental health conditions, right? So sometimes common mental health condition, we see this in our daily life. Sometimes we even see it within our coworkers, family members, or sometimes our immediate family members, nieces and nephews, and etc. Like depression, that would be something common. Anxiety disorder, bipolar disorder, PTSD, ADHD, eating disorder, and even substance use disorder and alcohol users. So some of these things are like the common, but when you deeper, like the factor that affects mental health, so we can understand here, you have the biological aspect. You're looking at like the genetic aspect. You're looking at the brain chemistry of this person. You're looking at their hormones. So now when you talk about genetic, is were they born, some people do have genetic mental retardation, I'm sorry if I'm pronouncing it as that, or mental issue where it is genetic. Some people, pick up, some people may, develop alcoholism in the womb when their mother was pregnant, and etc. Then you look at the psychological aspect of it, which is their personality, right? Coping skills and trauma. Trauma could contribute to a person having mental illnesses or battling with mental illnesses a lot. And you see this a lot within our African community, that a lot of young men and women have went through trauma in the hands of living with family member, be it good or bad. They have been through some type of trauma, and vice versa. That family member who was the caretaker to either went through trauma in the hands of that individual, that child or children. So it's a two-way street here. So just to be fair, and etc. So those are just the basic information on mental health, right? Now let's get into the deeper part. When a person is admitted, I'm going to break a few things down. And as I stated, I'm not a psychiatrist, neither a nurse. I'm just a mental health tech, and with my years of experience and from currently working in mental health and my interaction with the care team, I've also had the privilege of shadowing with a psychiatrist, just to have, for my own knowledge and volunteer purpose for medical school, which also helped me analyze my thoughts of not wanting to become a psychiatrist, because you have to have so much patience. And I'm such an emotional person. I'll most likely want to give my patient a hug, and that is not allowed. That is prohibited in healthcare as a whole when you're dealing with people with mental illnesses, and because of boundary issue as well. So when a patient is admitted into a mental health facility, the first thing they go through is their admission process, and that's a whole different team that deals with that. If it's their first time, either they came in voluntarily or non-voluntarily, meaning maybe they realized, they woke up, or their family member or friends encouraged them to come in to get themselves checked in and get evaluated by a psychiatrist, in order to determine if he or she has mental illnesses or is battling with something. If they were not admitted, if they came in involuntarily, meaning like maybe through by the ambulance or the state or law enforcement, most definitely they still go through admission process there where they do the whole 9 yard paperwork, body search, put the belongings away, and then find the appropriate unit to send them to that would fit or meet their needs. Once that patient is checked in, they meet with the first person they will meet with is with a nurse. A nurse will do their notes and documentation and get all the whole 9 yard before meeting with a physician. And then from there, they will meet with their physician, which is called consult. When they have these consult, oh man, some days the consult are great and some days it's horrible. Based off the physician consult with that patient, they could determine if the patient should be committed or if they are stable to return back into society after getting treatment, maybe for a month or 2 weeks or 2 days. So some people come in, they just stay in the hospital, they're admitted for like 1 week, 2 days, 3 days, and they leave, or 24 hours. And then you have those who are there on commitment, right? This is what we need to get into. When a person is committed at a mental health hospital, meaning the physician filed for commitment with the state, with the court. And what the physician is basically filing based off of their evaluation and their consult notes, informing the judge like, hey, this person is a harm to themselves and society, and they are not stable enough to return back to work or to society in general. So we need approval in order for them to get the proper care that they need to be stable and for them to return back to society. So there where it goes through process, and after the court agrees, then the physician would get back to, meet up with that patient and let them know like, hey, we file for commitment. You're here. Some people commitment is only 90 days. Some people 14 days. It varies on each patient. Some patient may like it and some may not. And this is where the fireworks comes in place. But it's only for the benefit and the good of that patient. But they're not seeing it as that. Because why? I want to get out of here. Why are you keeping me in this place where I have no means of having access to, using substance drugs or abusing alcohol or whatever it may be, terrorizing somebody lifestyle. And then for other, it works in their favor, especially the ones who are homeless. It's like, okay, thank you. I'm fine. I appreciate it. And etc. Kumbaya. And they go about their day because why? Hey, if I didn't have a place to go and a physician is filing for commitment for me, basically I'm going to eat free 3 times a day and get the best treatment that I need and hopefully find placement for me to transfer to after treatment. So that's where it comes in place. And at my job, at the facility I work for, we do have like a partial hospitalization programming for those who transfer from the hospital setting, where they can attend programs until they are fully stable to return back to society. So that's the first one they call commitment. And once again, only the psychiatrist can file, and sometimes a licensed social worker, if I'm not mistaken. I could be wrong, but I know majority of the time from working and doing shadowing, encountering with that physician, only physician is allowed to file for commitment on behalf of their patient. Okay. Lastly on the list here is Jarvis, right? What is Jarvis? So, for example, a patient came in and they have been refusing to take meds, right? Although they came in voluntarily or non-voluntarily, however, they have been refusing to take their meds. When they were out, they wasn't on medication, they relapsed, so which caused them to be admitted at our facility. Now that you're at the facility, you're refusing to take meds. It has been weeks, days, and maybe like a month. So this is where if the person have a POA, the nurse and the care team will reach out to their POA and let them know and inform them. So remember, a Jarvis will never be filed without reaching out to their POA. Like, hey, this is a situation on ground here. Your spouse or your daughter, son or husband has been refusing to take meds. So what do you want us to do? This is the next further action that we're going to take. We'll be filing for Jarvis. Jarvis is just a legal document from the court that allow the healthcare provider, including the nurses, to administer medication, meaning they're going to force you now to take your meds since you refuse to take it on your own and voluntarily. So now you no longer have the option to refuse or agree. You're going to be forced to take the meds. And there's two ways, either oral or through an injection. So that's what is a Jarvis. When a person, when you encounter somebody in a mental health, or even if you're new into the mental health spectrum, working in a mental health field, and you overheard, or your nurse may ask me, in the midst of discussion, say, hey, we're going to file, the physician will be filing for Jarvis, or they have approved their Jarvis. That's what it means, meaning we're going to force meds down into your bloodstream or orally for you to take your meds so you can get better and be cured and return back to society. So remember, mental illness is not a death sentence, but it's important to be aware of these things and understand. So when you see someone who have been depressed for pretty long time, like roughly over a month, where they're not coming out of their room or leaving their house, or just in a shadow place, or even having suicidal thoughts, please do not forget to encourage them to dial 988, which is the suicide prevention hotline. They'll call and they'll talk to someone, and they'll be able to redirect them and get them the proper help that they need. The more we talk about mental health, the better we as healthcare team, as being a person that works in healthcare, we all have to work together to help save life. One phone call could save a life. So until we meet again, thank you for watching, and I hope that was very educational, and I hope you learned a little bit about mental health. Do not be ashamed if you have someone who is battling with mental illness, even if it's you. Make sure you get the proper help that you need. Some is good to pray. It's very good to pray, but it's also good to get the help that you need, right? Because there are some things the Lord will not be coming down to cast out demon. God will not be coming down to cure everything. He has already given those who He has blessed with the wisdom and the knowledge to fulfill those things, to help cure people. So even if you are a physician or a nurse and you work in mental health or any healthcare field, right? You don't believe in the medicine. You're trusting in God that, Lord, as I'm giving this medication to this particular patient, that you're going to heal them, that they're going to receive the healing that they need. For some nurses who are Christian, a strong believer that prays for their patient. For me, like as a mental health tech, and when I was a CNA and a med passer, because I once used to pass out meds, like whenever I'm administering medication to my patient, I always pray for them. Even now, I'm working in mental health. Every morning I go into work, I pray for my patient. When I'm going back and forth, checking on my, patients, I'm always praying as I'm pacing back and forth in our hallway. I'm praying like, God, heal these people, help them to come to a place where, these are your own, these are your creation. You did not create them to be like this. So basically, faith, medicine, beauty, and that is the life of future Dr. Johnson. Until we meet again, take care and thank you for watching this video.